It was, I must say, kind of tough sledding. It was uphill, pushing a large rock uphill, trying to get this work accepted, because we even heard belly laughs from people who said, "What, you're studying height? Ha ha ha. How can that tell you anything about the standard of living or the quality of life?" Well, these people, for the most part, had never had a good course in human biology and certainly hadn't traveled around the world to see the stunted, malnourished populations that live in a world of low incomes, hard work, and high disease exposure. Tanner had seen this, of course, and oxologists knew that heights could vary enormously as a function of the quality of the environment. So adults could differ by 4, 5, 6 inches, depending upon the quality of their childhood environment. Of course, genes are very important for individuals, but they tend to cancel in populations. There's some debate whether the genetic potential for growth is equal across the world. I would say it's similar. It's certainly not as much as 4 or 5 inches that we know environment can cause. It might be a fraction of an inch or something on that part. But what we are seeing is where incomes rise, we're seeing a convergence of heights in different countries of the world. And so in East Asia, the Asian tigers are growing rapidly. Chinese are growing rapidly. Japanese have already done so since 1950. And these are populations once thought to be genetically short or small, even by Professor Tanner. It's just not true. That's not to say, there are pygmies. There are cases where genetics or endocrinology may be important for potential for growth, but environment we know is terribly, terribly important. So that's what we began to exploit, and the field began really flowering in the 1980s. We had a number of papers turned down, rejected for publication. It was almost impossible to get grants for this kind of work because people didn't understand the methodology. And so the early literature, to be successful, had to explain this concept of net nutrition, that one had a potential for growth that was constrained by diet, disease, and work. And how much of that growth was achieved on average for a population was a function of these conditions. And so at the same time, to understand why some groups were short or tall, or why there were fluctuations in height over time, one had 3 categories in which to seek explanations. That is diet, disease, and work. And connected to those 3 was inequality. So inequality is very important for average height, because imagine the following experiment: take $100 from the richest family in any country and give it to the poorest. The children of the very rich will not be impaired in their growth, but the poor will devote some good part of that to better diet or better medical care or something of the sort. So the greater the degree of inequality in a society, other things equal, the lower is stature. So that was a very important finding that I began working on in the late 1970s, and is now widely regarded today as important in interpreting heights. So the height field went off to many, many countries, studies of Sweden, Europe, eventually Asia, South America, addressing a whole host of questions dealing with the effects of colonization and colonialism. How harsh and how exploitive was it? About inequality or differences in height between social classes, between education groups, between occupations, the effect of urbanization on health and growth. And one found urban populations were shorter until the early 20th century, totally consistent with the idea that, well known, that mortality rates were high in the cities. So heights and mortality or survival are opposite sides of the same coin. Populations that are stressed, either through diet, disease, work, or poor medical care, what have you, also have high mortality rates and slow growth. So they tell you a lot of the same thing and give you independent verification of as a measure of social performance. So I continued to collaborate with people interested in heights in the United States. I've had students write dissertations on these subjects, and the field has flourished, but now dozens of people participate, and there have been hundreds and hundreds of studies published using that.